And good afternoon, everyone, and welcome especially to those who are just joining us for this afternoon. Great to have everyone else back. So this afternoon, following on from Jean's last question, we're moving from concept into the practical realities, particularly at the moment, facing COVID. How do we deal with the mental health issues, the anxiety, the stress, and what are the best practices to follow? And we start with Analaura Trivellato, who will talk about her research on the effects of different energy mindfulness practices. And then we'll hear from Ollie Robinson, who will talk about solfeggio. So the first half with Analaura will run from now until about 3:15, and we'll have a breakout just before, for 10 minutes before the tea break. And then we'll start again with Ollie at 3:30 and run right through till 5 o'clock with 15 minutes of wrapping up at the end. We won't be doing the word cloud we did yesterday. We've got another way of doing that, so we can invite everyone to participate right at the end. And there will be another breakout session after Ollie has finished his Q&A. So let me turn to Analaura Trivellato. Now, Analaura is not to be confused with her sister Nancy, and some of us may have had the pleasure of hearing from her sister on Thursday evening at the panel discussion on out-of-body experience. Analaura is speaking in a similar area, but not on out-of-body experiences. Analaura graduated in psychology and languages and holds an MSc in occupational psychology at Birkbeck University of London. And she's currently undertaking an MSc in applied positive psychology and coaching at the University of East London. She's an educator, a researcher, a coach, and an entrepreneur. She's been lecturing on anomalous phenomena, human development, and multidimensional awareness for over 25 years. And she's the president of the International Academy of Consciousness, the IAC, which is a global organization dedicated to the study of consciousness from a non-reductionist approach. So Analaura Trivellato, welcome, and over to you.
Thank you very much. Thank you all for being here and listen to this presentation. So before starting, I would like to mention to you a little bit of a background of this research, just to give you a little bit of a context on how it started. I have been teaching energy mindfulness for around 25 years. I have seen a lot of accounts of results that people have. Some people say it have helped with relationship, feeling more confident, and so on and so on. And some have really, really amazing results, but they are anecdotal evidences, let's say. And I want to go deeper into these and to understand the effects of these energy mindfulness practice, and in which sense or in which areas could I be able to perceive something or to detect the effects of that. So now that I have been more involved with positive psychology, I saw a window to work with people that are not non-clinical, because the positive psychology has a major concern to catalog and get involved into practices or interventions that would boost well-being, happiness. So it's kind of the psychology of the health, as in opposition to the psychology of cataloging the diseases and treating the diseases. So that is where I suppose it's easier for me to test this technique or to fit these practice. And mindfulness is part of the kind of interventions of positive psychology. So it's have actually conducted these research, thinking of a practice on itself without ideological perspective behind it and to a non-clinical population. So let me return to my slides here. There you go. Could you give me the, there you go, thank you. Good. So a little bit about the study. So this is an exploratory one, have not been done before in this way for this kind of technique. So then here I had a big trouble with the method, didn't know exactly how to use, what would be best. It seems that a quantitative one would be a good one, but would these be observations in review of, or qualitative? What would that be? So I will mention to you in a moment what I have opted to. I also had a difficulty to think about what would be the right dimensions. Where should I try to find the effects of this energy mindfulness? Because in spite of working for so many years with that, I still do not know exactly which areas to find. Anyways, and also we do not have a proper instrument to test and to measure these things. So then which instrument would I use, at least as a starting point? So let me tell you a little bit about the practice itself, so then you can relate to what I have done and what I am applying here. So the technique that I here call energy mindfulness is the same actually procedure of a voluntary energetic longitudinal oscillation that in short we call VELO. And the voluntary energetic oscillation actually describes the procedure, because the procedure is simple as in any mindfulness practice. The procedure is to move the energies internally at the center of your body, passing through your chakras, really deep inside of you. So the energy would run up and down inside of you, but at will. This is something that could happen spontaneously. And majority of the cases that we hear are spontaneous, but we can provoke that. And this has been, when I say energy, I think it is interesting that we have the same language. I'm using subtle energy for the lack of a better term. There is no proper consensus into what would be the best to describe the kind of energies of chi or chakra energy or prana or biofield, bioenergy. So all of them I am using here as a synonym. Para energy is an also interesting one, as para means beyond, so it could be energy beyond the physical energy. But anyways, this is just so we can have alignment in terms of the terms that we use here. So when we think about this energy mindfulness, it is actually an ancient technique. It's not something that have started now. It started in the Buddhism, have some texts that actually describe it without giving it a name. Obviously, there was no mindfulness at that time. Anyways, and describe something going, an energy going down the spine, and that was to create enlightenment expansion. People can feel that naturally, having during meditation, for example, and creating a similar one or a similar technique with Vipassana. It's a similar one. And it has been historically associated with some phenomena such as out-of-body experience. It seems that the energy moving the energy or doing these practices can facilitate the separation from the physical body. And also a lot I've mentioned feeling a energy running through the body. So for example, Silva and Modum have mentioned that the energy flowing and feeling like electricity. And some people do describe it in this way. Robert Monroe as well, and he actually coined the term of vibrational state, which would be the activation of the chakras. Then the person would feel a vibration with areas or everything. And this energy mindfulness is related to that and seems to facilitate this. The energy mindfulness has been studied in different ways, even inside of the IAC, in different surveys, but generally with people who already practice. And the idea was to see people who practice that, what are the sensations they have, or what are the benefits they have out of this. But on this one, my point is slightly different. My point is, can I actually teach this technique to people who never had previous experiences and people who don't claim to have any powers or any extraordinary abilities? And that is my major point here. So if they can benefit from that, what if to do this, people don't need to be gifted or anything. They just need to know how to put their attention to. So then they control the energy. Obviously, this would be an advantage for them by possibly having any benefits in case of any benefits directly from the technique, but also because of having the opportunity to grasp a different reality that goes beyond the physical reality. So I think these different dimension of being also can be accessible in this way. So in order to move the energies and to do this energy mindfulness, the number one thing is that people need to know where to put the attention and need to put the full attention into the energies. And that's what mindfulness does brilliantly. So then when we think about mindfulness, which is mainly focusing the attention to something, and here I'm proposing energy, as well as the other aspects already being, how can I say, explored by mindfulness, the physical sensations, the thoughts and the emotions. But also it has an interesting, how can I say, it also, the energy mindfulness also have this centering, which is one of the characteristics of the mindfulness, which means that the person would alter a little bit the
Analaura,
yeah.
Sorry to interrupt. I think your screen share may not have activated fully. It's just a black slide at the moment. Could you?
Yeah, I will do it again.
Yeah, try it again. Thank you.
Oh, good that you mentioned that to me. Don't worry, I'll do it now. Do I have co-host?
Yes, you do.
Now I do. Good. Now it's perfect. Taking a moment. Sorry. How about now?
It's starting. Yes, here we go. That's it.
Good.
Thank you.
So these are basic characteristics of mindfulness. Decentering, so the person altered the relationship with emotions, thoughts, physical sensations, but also this identification. So being able to disidentify from that. So I'm not only my thoughts or not only my emotions. Let's say historically, mindfulness have started with the mindfulness-based stress reduction. So it has been used mainly in these areas and started around in the late 70s, majorly with Kabat-Zinn, who started the mindfulness-based stress reduction, researching in this area and applying to patients. So then he had very good results. And since then, it has been used for pain reduction, some skin disorders. But now with the positive psychology that I was mentioning to you, then it now has been used recently for happiness, improving well-being, and so on. And that's where I'm going to work here in this research. So what I have decided and proposed to do here, a quantitative at first, Later on, I noticed that a qualitative will be actually probably inescapable. I'll need to do it because it's intrinsic and it will be needed. I'll show you later on. But anyways, my idea was if I need to measure a effect of the energy, or that's my proposal at least. So then I would need to repeat the measure in order to see over time, what would be the effects, what would change for these people. So then I applied one questionnaire, and the same questionnaire later on, actually the timing here, not sure if that was enough or it was too little or too much, but here was a little bit less than a month. It was around 25 days. Generally, when we have mindfulness, majority of them, there are short, brief ones, but some of them are like 8 weeks or 10 weeks. So the doses is still very difficult to know exactly. And anyways, and I randomized the people and made a big, how can I say, put a big concern into making sure that I don't induce them to do anything. So then teaching and helping them. Imagine if in mindfulness, we need to pay attention to our breath, and it's still, we know it's difficult because mind wanders a little bit. Imagine paying attention to something that is non-physical, such as your energy, your subtle energies. So then obviously it's natural to think that people would have a little bit more a challenging situation to pay attention to that, or that's what I thought at the beginning. But then my idea was to use a different samples that I'm going to show you in a moment. So what's the instrument that I have chosen? I have chosen this one that's called DAS. It stands for Depression, Anxiety, and Stress Scale. It's 21, the name is 21 because it's 7 questions, each one of them. I have applied this one because it's very well established. It's largely validated for many years, translated, and because a lot of mindfulness research have used this one to establish the pattern for how much these would be beneficial or not in these areas. But and also here there's another point. It's a simple scale, Likert scale, 4 points, 0 to 3. The higher the number, it means less well the person is in that dimension, say in depression. Now here for me, this is just a baseline. That's all I need to know from this. And also I know this is far from perfect instrument, but I think it's a good starting point. And it's not something to make a diagnostic. It's an indicative, and it's majorly used for non-clinical populations. So just giving you a little bit of the a flavor of the measure that I have used. It's 7 questions on depression and has subscales. So inside of depression, it would measure these and these. Inside of anxiety, it would measure these other aspects. Again, always negative and always 7 questions. And the same for stress, measuring these elements or these aspects. Now, what we have done is that I have created a subtle energies effect scale, and that comes from research. Also comes from a book, a research that my sister actually have also done in this area, thinking about how people would relate to the technique. So to this practice. So, and what would be the benefits they normally get? So we have created, again, 7 questions with these, using these elements in each one of these aspects. And we have put these along with the questionnaire. So it's all intertwined with the other questions. So people would not know what we are questioning and what time. So even one person asked me, are you sure that's the right questionnaire? So they did not know what I was measuring, which I think is a good, it's a positive thing. So let me tell you a little bit more. Can I go on with about my research, the proper research here? So the predominance were females around middle age, college plus, and we had 30 countries being contributed, right, participate. Now, in terms of demographics here, I have asked about having training or workshops in the area because I thought this could make a difference and also would reduce any bias in case any. So the huge majority had not attended any and have not practiced this before either. When I say these, I mean any kind of mind-body practices, all of them. So I just let the person to be like any kind of meditation or energy or not or anything. So 64% had no experiences into that and no training. 20% have attended any kind of courses at the IEC. 16% have never, has attended courses, but in other institutions. So let me tell you a little bit about the profile of these people. So I started with 541, but then it reduces on T1, which is natural, right? On T1 means the questionnaire number 1, the previous one, before the practice, and these had 344 respondents on this one. And on time 2, I had 299. So my last number would be 299. So what I have done in these research to organize the groups is that I noticed from their registration that a good number had no practice, no course, as I have mentioned before. So then I have done a random allocation for some to do the energy mindfulness and others to be inactive control group. They have not done any other practice, so they were just on wait list, let's say, inactive really as a control group. And the interesting thing for the both G1, meaning group 1 and group 2, is that no knowledge about energy or mindfulness or no trainings. So that's the major characteristics of these ones. The remnant of the people, they had previous experiences. So then I organized a group 3 and I allocated them there to see if this would make a difference, having a previous knowledge or experience or having been using perhaps recently any kind of mind-body practice. And I put this as a very open question. And just a few people were taking antidepressants, so any kind of psychotropic drugs. But in any ways, I measured them as well. It's a smaller group, less of a focus here. So let us see what were the results that I have got after this period of applying the technique. So pre-test is in blue, post-test is in red. The group 2, G2, means the people who were doing nothing. They were my control group. The group 1, non-experienced. And the group 3, who had experience, had a significant effect here in terms of depression and improvement in depression, because you see that the numbers, the higher the number, the more, in this case, depressed they are. So then it starts in blue and finish in red. They had a reduction. And anxiety, it was a different case because everyone has improved, even the control group. And I would speculate that perhaps as anxiety is the anticipation of an event to happen, generally it would be a negative event and then people would feel anxious. Perhaps for these people would be something positive that they were waiting for. And then perhaps that would be the case why they got improved. But really that's just pure speculation. But anyways, in this case, all of them have improved. stress. The control group actually got worsened here. The group 1 had improved, but not significantly, and the group 3 was significant, had a significant effect. Now, what matters the most here would be the energy effects. So on this one, the group 1 and group 3 had significant effects, improvement in terms of the energy in these aspects that I have mentioned. And an interesting thing is that the group 2 also had zero change, actually almost as if they would remember the previous questions, which is impossible. It's 28 questions, and they are mixed all together. But that shows that the scale has some reliability, it seems, or at least from the evidence here, but need still a lot more studies, obviously, into these. Anyways, on group 1, no experience, and they improved. And group 3, with experience, they also improved. So this is a very interesting result, I suppose, because it shows that, or at least indicate that perhaps a previous knowledge or a practice would be an advantage, because the group 3 had good results in all these scales. But for the energy specifically, people with no experience could also get a good improvement. So it seems that there is no need for special or non-ordinary abilities in order to do this. You do not need to be psychic or gifted or anything. And also, these people didn't even know what chakra was or energy was. I just told them to practice that and follow my guide. So I have provided them with a program where they received videos, explanation, and audio guide they would follow as a typical, mindfulness guide, So then they have applied that without even know exactly what they were doing, without knowing exactly what I was looking for, and they seem to have had some good results. Obviously, this is all very preliminary, and I certainly do not think this is final at all. But I wanted to share something else with you, which was a surprise for me. In the middle of the period after, around 2 weeks, a little bit, 2 weeks more or less, people started writing to me, and they started telling their stories. And there was a flood of emails with very interesting things. And that's why I think, okay, the numbers would help somehow, but actually I think I would need a little bit more, and a qualitative would be needed, a qualitative analysis would be needed on this one, because people felt like sharing and they did it spontaneously. So then what I have done is that I started collecting, and I followed their lead actually. And on the questionnaire number 2, besides the questions they have answered, I made an open question for them to tell me any change they might have perceived. And I received another enormous amount of data, which I have not done an exhaustive, thematic analysis or analysis of each one of these terms and so on. But I have collected some of them, and I wanted to share with you. I kind of put some categories here because they were really powerful. And so I thought it would be interesting to share with you a little bit of these ones. So a lot of people have mentioned being more energetically or emotionally stable, feeling that. So have a look at these ones. Despite a life-threatening situation with a family member, I was able to remain calmer and more level-headed. Not sure how to explain it, but I handled difficult emotional confrontations from a fine place from calm and stability. Again, we don't know if that is related to the practice, but at least there is an indication that happened during that time. It needs a lot, obviously, a lot more research to be able to determine a little bit more if that is related to the energy mindfulness or not. Anyways, someone else said, I felt a tickling, calming sensation in form of my massage flowing through my body. At times I experienced heaviness in my chest, but this cleared as I continued to focus. Unexplainable calmness and peacefulness covered my entire body sometimes. So it seems to be nice. Another one, more or less towards this area, and that was really touching. Some of them were really, really touching. I take care of my mother with dementia. Our whole life has become calmer and more manageable since I do the practice at least 3 times a day. I have also found that when she has psychotic episode, I can calm down much faster if I start exercising as soon as I can. And over time, I have been able to live we have been able to live a life more pleasantly, regardless of what is happening. So it can kind of reach people's lives, and that is quite something, or at least it was really touching for me. I am calmer, happier, improved sleep, and more energy. My concentration has improved, and intuition and clarity is stronger. Someone else said, I felt much less tired after a work day. I have much better control over my emotions. Someone else also said, I feel and was told I am behaving more openly, much more openly. I notice much less fear talking about certain subjects. Who knows what that is, but anyways, it's a good thing. Some other people talking about this more emotional stability. When doing sessions that I lasted more than 15 minutes, I was more disposed to help others, just felt natural, and I wasn't affected by any person's mood or energies. So that's another interesting aspect that is related to not being kind of contaminated by energies around. Some chronic health issues have been mentioned by these people. Someone have said, I have had Hashimoto's for almost 30 years and have to have my blood values checked constantly. 7 weeks ago, the values were very bad. Last Tuesday, I did the blood test and my doctor has just called me now to tell me that all thyroid values are in the green. I have never had such good value before. Again, we never know, but interesting of having these exactly now. Anyways, my rheumatic pain has decreased significantly. We went down from 5 to 6 to 2 in level of pain. Someone have mentioned I developed much lower blood pressure. On my last week of practice, the doctor and I were surprised as my blood pressure has been chronically high. Some other people have mentioned about blood pressure. Anyways, just a few more here as we still have a little bit more time. So I would always wake up once or twice every night. I'm amazed every day because it doesn't happen now. How nice. I have forgotten how much good it felt. So very nice. Other people have mentioned well-being and happiness improvement. Someone have said, as I have had surgery 4 times this year, I had no idea that this practice would make me whole. I now go to bed feeling so good and sleep without difficulty. Also, upon awakening, I feel awesome, peaceful, relaxed. Someone else have said, after only 5 minutes of practice, I could feel more awake, and after 20, 25 minutes, I could feel bliss. I was totally energized. Other reports here, I feel several years younger and much happier now. Someone even said that I'm feeling intelligent. That's an interesting one. Other person has said easier waking up and warm, mellow, pleasant feeling all day. Some people also have mentioned out-of-body experiences, which, as I said, it has been the major aspect related to this, the vibrations and the out-of-body experience, or generally, right? And the interesting thing is that these people had no idea they were having one. have a look at this first report here. After a few minutes of the exercise and while laying down, I felt my leg gradually lifting upwards towards the sky. So I had to make the energy flow to go up in an angle. Is that normal? So obviously the person, now we know the person was having a detachment of the legs, but the person didn't have an idea and didn't put it a name. So it was completely spontaneous. Someone else have said, a few times my body would float or would feel myself leave the body and disintegrate like dust particles. Very interesting comparison of this person. Other ones have said, I did a long exercise before I fell asleep. And then at the night, I clearly experienced a spin of bright light around me, turning to the left. I was sure my physical body was not moving. I felt like having light dizziness. This state lasted a few moments, I think, not sure. And it was exciting. So it's probably, again, an OB. And someone else have said, finally, I could have an OB at will. Some people have also mentioned vibrations, which seem to be very connected with the energy mindfulness, the ability to move the energies. Someone said, after only 30 seconds, I suddenly felt like a huge vibration, first in my chest, then in my whole body. My body was gently shaking as if electricity was passing through me, but the feeling was very pleasant. So this feeling of electricity, a lot of researchers would mention that, like Robert Monroe have mentioned, Silva Muldoon, as I have mentioned before as well. So the increase in flow startled me, someone else had said. The energy was a little scary as it took over my whole body and stayed with me for an hour. But then I felt amazing. I wanted to rush to the phone to describe it to you. So I had very, very nice participants on this one. And someone else have said, I was just a vibrational being. So the person describes how the person was feeling, and that was very interesting. Some other people have mentioned about having a different sense of self or inner self. So this person have said, I have had a terrible struggle understanding a real inner me. I had no clue how to find the core me. The last night I contemplated the question, who is the real me? Gosh, she just came to mind. I could feel her, see her. It made me joyful. This new insight is amazing. It has given me inner strength and a new perspective. It's odd how you leave that part of yourself behind in the dust of every compromise you make with yourself. So the results so far have been interesting. As I said, I was not expecting people to share all of that, but it was very good because it pointed me to the direction of having numbers is very good, but we need the people's accounts as well. We need to see what people say about it. I would say encouraging, but needs more. And it's certainly a very preliminary results that I have got. Say my next steps would be to aggregate more data. The control group was really eager to have to apply the technique, even not knowing what that was, and the practice. But to have the practice, the program, teaching practice. So probably I am going to do this with them. They are actually doing this now. And I'm going to collect the data, aggregate the data, and see if what we come up with. Obviously, a qualitative analysis seemed to be necessary. I also think about expanding these subtle energy effects scale, perhaps getting different attributes of the energy and expanding that, perhaps following the same, how can I say, structure of the DAS, maybe, yes. But anyways, expanding that. So it seems to be possible to measure somehow this over time. And also I want to do a cross-cultural research, so doing this in different languages and being able to bring with different results and aggregating more results to this. I would say thank you all. I want really that this research could inspire other people. I think most of all, I would say I would like to inspire people to have more research in this area, and that people would understand like the energies or the subtle energies as something really real and worth being studied by science, but also being experienced by people. Thank you for listening to me, and I'm ready for the questions.
Thank you so much, Analaura. Could you stop sharing your screen now so we can have the benefit of seeing you on the screen? Wonderful. Thank you so much. What an exciting set of research results you've achieved.
Thank you.
It's fantastic. There have been a number of questions on the chat from Noelle and Helen particularly about the practice that you were teaching everyone. We've been asked, could you possibly share that practice or at least say a little bit more about it?
Yes, absolutely. It consists on the movement internally of your own energy. So the number one thing would be to perceive your energy. So that is why the mindfulness would help so much, because we need to put the attention into something that is abstract, that goes beyond the physical sensations. So then the person, by perceiving identifying the energy, let's say, and observing that, the person will be moving the energies at will internally. So in the center of the body, going from the head towards the feet and back from the feet to the head. And doing this constantly as an oscillation. It means up and down. There are other research into that. Nancy actually also have a research into this, but more on the area of people who already apply the technique, and how do they feel and how their perceptions. But on this research, the interesting thing is that I teach people to move the energy up and down, and sometimes not necessarily they would feel it, but I said, if you don't feel it now, you just keep doing, focus, and in a positive way, because it seems, and that's what it seems to be the case for me. Practice is what is key. So if the person keep doing, eventually this will come, but for some people may take longer, because it depends on the how can I say, the fluidity of their energies, besides obviously their capacity to pay attention, to focus attention, full attention into the energy. So besides having that, they will have other elements, like their possible blockages in the chakras, even possible fear about that, or any other emotion that could interfere into that as well. But the technique is actually simple to explain. It's just moving the energies internally. We have seen that this technique can induce the vibration state, which is a name that actually has been coined by Robert Monroe to determine this activation of the chakras and of the energies. But the technique itself, or the practice, is that. An interesting thing is that people who have known the technique, they also have benefited. So just by knowing that theoretically doesn't seem to make any difference. That is an interesting thing, because it seems that if you don't practice, it doesn't work. It's a typical mindfulness.
Right. Great. Well, thank you for that. I think you've explained it very well. And Wagner has added on the chat references to Nancy's work.
Oh, that's good.
So we've got 6 people with their hands up. So I'm going to move to those.
Someone is asking about having participants from the IC. No, it's a smaller number from the IC. The huge majority have never heard of the technique.
Yeah. I think I'm going to move to the questions next, if that's okay. So John Cap is first. John, I'm going to take them in alphabetic, well, in order they've come up, Andrew. So John
Yes.
Cap first, then Noel, and then Vanessa.
Go ahead, John.
Thank you very much, Analaura. It's very, very good results. I'm very pleased to hear it. I also teach mindfulness, so they're not surprising to me. But could I ask, in relation to COVID, were these face-to-face before the COVID, or were they online afterwards?
Oh, great question. Great question. They were all online afterwards. So it was actually a bit of a challenge to organize that in a way that I would maintain a connection with people without actually meeting them face to face. Majority of the programs related to mindfulness, we know they are longer. They require a lot more time. I have noticed that people actually did not, or I think they have not, from the results, I have asked that question, and it seems they have practiced less than I have asked them to. But it's understandable up to a certain point. It's something completely new to people, and it has been done all online. So they were sometimes sending me emails with questions, then I would record a video and send it to the whole group. Or I would see the questions and then send a email with written instructions.
Well, thank you very much. It's so important, because the mental health of people post-lockdown, and we've got another one on now, this is very, very relevant. So very good luck to, I think these should be rolled out much more widely. Thank you very much.
Thank you, John. Very much agree with you. And so Noel, would you like to speak next?
Yeah, thanks. You've already asked my question, and Analaura has answered it, so thank you very much.
Thank you. Thanks very much. So Vanessa, you're next, then Simon Cotton, and then Nancy.
Yes. Okay. Thank you. Thank you, Una.
You've just broken.
Oh, okay. Can you hear me now?
Yes, go ahead.
Yeah, oh, good. Yes, yeah. Thank you, Annalisa. That was very interesting. I just wonder if you could expand on the relationship, as you see it, between mindfulness and the subtle energies and the chakras, and whether there have been any reports in any qualitative data you've acquired of a negative result rather than beneficial. I don't mean to put a dampener on things, but I only say this because I once had quite a destructive experience with what I see as subtle energy. I was going through a very acrimonious divorce at the time, but I had what I consider on reflection a spontaneous Kundalini experience where great energy was whiplashing up the back of my spine. And I felt if it hit my head chakra that I was going to die, quite honestly. It felt so, I was so panicked by it. And in fact, it recurred to a lesser extent in following weeks. And the only way I could manage it was by taking some herbal remedies that suppressed it, dampened it down. But in the end, only with beta blockers was I able to control it. So I felt that was quite a destructive, non-beneficial experience involving the chakras. So I just wonder if you could tell me more about would mindfulness have helped in that situation, do you think?
Yeah. So the number one question you have mentioned was the relationship between the mindfulness and the subtle energies and the chakras. Subtle energies I'm using as a synonym of chakra energies. I would say all the chakras we have would be building, or let's say, we have an energy body, let's put it this way, because it follows the body shape. So that's why it's made of chakras, so it makes this body of energy. So in any ways, I'm calling these as synonyms. Energy, subtle energies or chakras. Mindfulness would help in this by helping people where to put the attention to. So that's the major, I would say, relationship between these two aspects. as mindfulness would be a practice of training your mind to pay attention, focus in one object only. This object could be anything, could be eating, could be movement, as we have seen with Tamara, for example. And this is the relationship with mindfulness in that. So what I am proposing here is that your energies could also be your object of your attention, and you could have moving your energies. You could also respond, your energy body respond in a different way. So now the relationships it's very simple actually, right? It's related to attention, but in relation to negative feelings, I had some people, but were the minority. One, for example, have mentioned being more aware of pain, someone who have a fibromyalgia. Someone else have mentioned, for example, having difficulty to flow in certain areas, feeling like as if there is a resistance, so they could not flow, but they didn't describe that as necessarily negative. What happens that I suppose it depends a lot on the situation, the emotions, and so on. And some people may have situations like these. What I have done is giving them a lot of guidance as much as possible online to not to be harsh on themselves in terms of being demanding. So they would go as the flow would come. So perhaps that's the reason why I didn't have many cases, as far as I remember, only these two that were more towards, let's say, the negative. So another thing is that I gave them an audio guide. So then in different timings, different lengths of minutes. So I suppose people managed to do it in a way that would be in a pace that they could follow. So perhaps that's one of the reasons. But some people do mention having these situations, because I have been teaching this, and I know that sometimes blockages may create these feeling not so well. I don't remember exactly the terms that you have used, but generally this feeling goes if you keep doing, but without forcing yourself. You just go like constant moving and moving. Also would be good to be able to assess that person face to face, because having a lot of experience, it would be possible to assess the energies and see if there would be a blockage or even an interference of the external environment. The energy movement, this energy mindfulness, seem to also improve that capacity to not be so influenced by the environment. So the more you do it, even perhaps some people may not feel so pleasant at the beginning, but then as they keep going, they manage to improve the quality of the alignment in their chakras and of the environment. So it does flow to the environment in a second step. So that is possible, but yeah, it seems to improve over time, if you understand.
Thank you.
Another thing is that, just let me compliment that some people feel a little bit afraid and feel this is a little bit mystical. And I suppose one of the reasons might be as well that majority of these people, they had no idea what they're doing. So they didn't have any like expectation. So perhaps that have helped as well.
Yeah. Thank you, Analaura.
Mm-hmm.
So the next question comes from Simon Cotton.
Thank you, Una. And Analaura, thank you very much for your fascinating presentation. It resonated with me. I just wanted to ask a couple of questions further with regard to the practice. First and foremost, with regard to synchronization with the breath, was my first question. The second question was visualizing colors.
Mm-hmm. Okay. So number one, about the synchronization with breath. We know that some techniques actually use the breath to do this, to move the energies, and sometimes even unconsciously. So what I have requested to people was that to not associate the breath the pattern of the breath with the pattern of the energy movement as much as possible, because I know that for some people who have had previous experience in this area and have trained for so long to do this, it might be very, very hard. So the ideal thing is that there would not be an association. Why? Because if you may need to alter the velocity of your energy movement to follow your breath, or the other way around. So this should be, in principle, two separate things. One is my physical body, what I feel, my breathing, and so on. And another thing is my energy moving. But I know it takes time. For some people, it was quite a challenge. So these were one of the things that I had to address quite a lot and talk to people about, because they did have some difficulties, the people who have practiced this in this way. But for the energy mindfulness, that is not needed, and actually it's ideal that you do not associate. So you kind of train your brain to see these are different things. I can do something with my energies regardless of what is happening with my breath, right?
And the point about color?
Yeah, and about the color, I do not use that either. I just use people sensing and following the energy, the flow of the energy with their minds, just perceiving without using imagination, colors, or anything, or music, none of this.
Thank you.
Thank you. We've just got time for 5 minutes more of questions, and they're ramping up. So your sister Nancy has a question. So could we keep the questions short, and Analaura, maybe you can also try to answer quickly.
Sure, thank you. I would like actually to make a comment, because I had researched about this technique and the phenomena of the vibrational state for 15 years, following people through personal sessions and making notes. And then that derived in a book that people expect to be a guide step by step, but it's a little bit more technical than most people would like. And what happened here, and that's the point that I wanted to comment, is that Analaura, when she did this research, I thought it was going to be not possible for just anybody to do it, because it requires a lot of attention, but especially when I hear the qualitative accounts, what people report they experience, that is very much in line with what we experience when we work with energy. So dealing with this for almost 30 years, teaching and guiding people, so I thought it was important to mention this, and I think there is validity in pursuing that. So that is the point I wanted to make, because congratulations, Analaura, it was very brave.
Great, thank you so much, Nancy.
Thank you.
I'll just head up. The next three are Jeanette, Wagner, and Dimitri. So Jeanette, if you'd like to go next.
Hi, really interesting presentation, thank you. I think part of my question was already addressed, which is around whether you had people having problematic experiences with the energy starting to take on a life of its own and coming up unbid, or keeping people awake at night, painful sensations. And I know what you're saying, that as the process runs further over time, the blocks can get lessened and more blissful experiences can come up. But it can be a very intense and turbulent ride, and you can feel very out of control with it, and very frightened by the power of this force that comes up and seems to burn through you and out through your top of your head. So yeah, I think it's great what you're doing, but a bit of me thinks be careful, because you can trigger people.
Yeah.
Thank you.
Great, thank you. And Wagner?
Yes, thank you. It's just a quick comment that many times people ask us if this energy is just a kind of subjective effect, something that we create inside of our mind, just like a state of consciousness. And I have been researching this through EEG and functional MRI for more than 10 years now. I would like just to comment that we can see mainly with the function MRI, that this creates very specific states in the brain. And I had some experiments in which I put other people inside of the machine and other people transmitting energies to them, and the signal, the bold signal, the function MRI appeared inside of the person's head, even the person not being committed with the procedure of doing Velo. And interesting that I put a chicken egg inside of the machine and I transmitted energy myself from out of the machine, and it was very synchronized. When I start transmitting energy to the egg, the bold signal appeared. And when I stopped, it disappeared. So this is not just an artifact of movement. So this is something real. Certainly we want to understand better the mechanisms of this and what kind of energy it is. But it's just to support what Analaura was saying, that this is more than just an internal procedure. This creates an objective change of something we are calling now just energy, but we have to go deeper on that. Thank you.
Fascinating, fascinating results. Dimitri, you're
Yes,
next.
hello. Thank you very much, Analaura, for your presentation. I've been able to participate to the study, and I have a question about going further in a technique, the Velo technique, because I feel partial body detachments before sleep and muscle spasm, and I was actually asking myself how to get through those spasms in order to try to achieve an OBE, for example.
These techniques seem to be very connected with the OBE, and there are different techniques to lead the body. So what we generally recommend, and we do have trainings in this area, is that you apply this energy mindfulness practice before any technique to lead the body, and that helps you. Another thing is that I have worked only with one practice, which is the energy mindfulness in terms of moving the energies in the body, but there are other movements that you can do with your energy, and actually these could improve your capacity to do more, moving more energies in a more stable way, and giving the pleasant results that we are expecting. Pleasant results is what is expected. So it comes with the practice.
Thank you.
Thank you.
Thank you. And I'm just going to take Inna now as the last one. I know John Knap's got his hand up again, but he has already had a question. We're out of time. So sorry, John, I'm going to take Inna and then we will wrap up.
Hi. I just wanted to ask your opinion as to what do you think is the effect of the SSRI antidepressant use on an energy vibration and kind of the effectiveness of those practices?
Very hard to say. We have no studies about this so far, at least not direct studies. I really don't have that answer for you, to be quite open here.
Okay, thank you.
Yeah, we would need actually perhaps at a certain point, perhaps using the technique with clinical people to see if that would, how much that would affect them, and then determine that. But nothing at the moment that I could be so precise.
Well, thank you, Analaura, for such a fantastic presentation, such great research and results, and for sharing all of that and answering everyone's questions.
Everyone
thank you
for the questions.
And thank you everyone for all your questions. We're not going to see Analaura again because we're going to go into breakout groups and then tea. So shall we just take ourselves off mute and show our appreciation to her? Andrew, can you do that for us before we go into breakouts?
Thank you.
Well done. Well done.
Thank you, Analaura. So you can all unmute yourselves now if you wish to, just for very quick. Say thank you.
Thank you.
Congrats.
So you're going to send us into breakout groups now, Andrew.
Yes, I am.
And come back at 3:30, please.
Brilliant. So we'll go for a 10-minute breakout rooms, and then come back out of that in 10 minutes for 15 minutes tea break, and then back here at 3:30. So I'll open up the breakout rooms now. Okay. You'll see the invitation on your screen, so just accept that. And if you don't wish to go into a room, just don't accept the invitation to go in.
Oh, hello.